thank you very much. Our attitudes as far as when talking about cancer is we don't think about a lot of times is what is our financial health and what is the financial impact? Because remember, the number one of the leading, if not number one, number two cause of bankruptcy in the United States is healthcare costs. And to that end, our final speaker today is going to be addressing this unspoken issue, and that is Mr. Reeves, Hayden Reeves. He has expertise in clinical and epidemiological research as well as healthcare quality improvement. He has interest in healthcare legal and financial policy as well as maintaining patient well-being and quality of life. He is currently a clinical research coordinator, one position with CHARM, which stands for the Cancer Health Services and Research Methods Team at the University of Alabama, Birmingham, Division of Hematology and Oncology. Today, Mr. Reeves is going to speak to us on financial health literacy. Mr. Reeves.
Thank you. Yeah. One sec. I think I want to get my lav mic on so I can walk around here. Okay. Oh, can you hear me? Okay, perfect. I'm just gonna hop down here real quick. All right. Well, good afternoon, y'all. Come on. Can we try that again? Good afternoon, y'all. All right, thank y'all. I honestly did not get enough sleep last night, so if I yawn, I apologize. I needed that energy boost, so thank y'all for that. So today I'll be talking about financial health literacy for patients with cancer. And just as you know, oh, why is the text not showing? Anyways, my name is Hayden Reeves. I'm a clinical research coordinator at UAB Hematology and Oncology. I think this is a good time to clarify. I am not a financial billing expert. I work in clinical research. I'm not like in health insurance, but I have had the amazing opportunity to work with patients who have gone through the healthcare system, who have financial or legal difficulties that that are expected to be from a cancer patient. And if we go here, nope. Let's see. Oh, wait, there's text finally. Okay, yes. So I've had the amazing opportunity to work with research studies relating to legal/financial navigation. For example, one of our studies works with Triage Cancer. They are a nonprofit organization that has attorneys on their team that provide, a lot of different resources. I'll actually have a resource slide at the end of this presentation with different national and local resources to this state. And Triage Cancer provides different services, like, for example, if you have to take off employment because of cancer, what kind of resources you can do for that. And yeah, just to start out with, I think Ms. Morales said it amazingly that you are your own best advocate. I guess you're the only one that lives in your body 24/7. You're the only one with the life that you have. But also, just as a cancer diagnosis, there are expected difficulties with your cancer. There's also expected difficulties with your finances as well. And I think one of the most important things is that, financial difficulties are expected, they are known, they're common. It would also be a miracle if y'all didn't have any. And this is not any kind of personal reflection of shame or failure. This is something that just happens. And I think Ms. Jasmine really went over that amazingly well last time. And about, the different costs you might expect, as a cancer patient. Here's what you would expect, what we call, direct costs. You have your insurance payments, you have, your deductibles, your co-pays, especially your prescriptions, imaging, labs, other procedures. But something that we don't often talk about are the indirect things. This could be, if you have to, leave your job, you have lost wages. If you have to have a caregiver, then you might have to pay them for their time, and they might also have to take off work to care for you as well. And we were actually able to do a study on cancer patients that were part of a clinical trial at UAB. They were given a reimbursement every month for 4 months, and some of the things they spent the most amount of money on was transportation and food, especially if they live far away, like farther south or just even out of state, the amount of gas prices is crazy. The amount of parking you have to go to in downtown Birmingham as well. It's not. I know, right? Yeah, it's not amazing. And especially food. Groceries, restaurants. Especially if you have some kind of diet-specific food as well. And if you have kids, that's also another one as well. I don't have any kids. I can't imagine how expensive that must be though. And for home health also relates to being a caregiver. And so in general, we call this financial toxicity. This is the financial burden that patients go through as, part of this healthcare system. And, from high healthcare costs, medical debt is, like we said, the highest cause of bankruptcy in this country. And I know it's all kind of doom and gloom. It can be like a snowball. It keeps rolling, it gets bigger and bigger. But there is hope. There are ways to combat that. There are ways to take control of your life. But unfortunately, some of the things that financial toxicity can cause is not adhering to your treatment. You could maybe skip or have delayed doses, let's say of chemotherapy, and just overall worse outcomes. But there are different ways to do that. And like I said with the reimbursement thing as well, some of the things that patients said most about that was they had, high out-of-pocket costs, which is to be expected, surprise bills, there's prescriptions, appointment scheduling as well. I mean, I can't count the amount of times I've talked with patients that they've said they just had so many calls and so many appointments going on. It's hard to coordinate anything because with cancer, your life just becomes that much more hectic with work, childcare, transportation, and employment difficulties as well. And that's not even beginning to mention, if you're trying to get something from insurance, but they deny your claim, and there's delays with prior authorization. And there's also estate planning, which it's not really something I mentioned before, but it is something that doing as soon as possible would be ideal. Waiting until if you're in a panic state or like just in a time of crisis, you're not in the best mental state to do that. So if you could do that as soon as you can in a nice, relaxed area, that would be awesome. And just in general, like what Ms. Morales said about you are your most best advocate for your financial health. I hope to give a plan and a roadmap about how to actually put that into action, the steps you can take today to have a plan moving forward. And so what to expect as a patient with cancer or just a patient in general in this healthcare system. You have your basics, your deductible, which is the amount you pay with covered health expenses before your insurance plan contributes. But you also have your out-of-pocket max, which is the max amount you pay in a year before insurance completely 100% covers everything. There's in-network versus out-of-network. Ideally, you get in-network so it's not as expensive. And there's also, prior authorization requirements, referrals. But most importantly, this is where you would ask your care team's financial navigator, like I said, being advocate for your own health, asking your care team, it would be your social worker, financial navigator, to really go over every single detail because, if you don't speak up, then it'll just be silent and, you won't get the information you need. And of course, if something gets denied, appeals, you have the right to appeal anything. You have the right, it's not just a favor, it is your own health. So please be loud, be proud, take action. If something is denied, have everything in writing. Make sure everything is recorded, ask for the letter, the specific reason why it's denied, and take action to file that appeal. Insurers need to explain why the reason and the process happened, and of course there is external review available after everything is exhausted, but not exhausted. I can't read today. But also, there's there's public coverage options as well. There's Medicaid, but unfortunately, Alabama has not expanded Medicaid, so eligibility is a bit narrower than usual, but income limits do matter absolutely for that. for Medicare, if you're 65 plus and disabled, you can do that. But there's also marketplace plans as well if you don't have, I guess, employer-sponsored insurance. But unfortunately, the marketplace premiums are higher this year, but that is still very much an option. And just, just some last things there, employment protections especially, there is FMLA. That is a very important one where you will still have your job protected, although it'll be unpaid leave. There's also workplace accommodations if you still able to work and they can accommodate for you. And also there's disability insurance that employers can offer as well. There's either short, which is a year or less. There's long-term, which would be longer than that. And like I said earlier, there is estate and legal planning. It's not just something that's end of life. It's access planning. For example, there is power of attorney, which is someone who can legally act on your behalf if you're not able to do so. And there's also an advance directive as well, which is, I guess, your directions for what happens legally after you pass away. And with that, you would let a trusted person act on your behalf. It is best to arrange that as soon as you can, especially with everything that's going on with insurers, employers, providers. And like I said, it is best done early when you can, calmly when you can. It is important to be in a good mental space. Obviously, it's not always easy to do that, but there's always so many resources to help you. Like I said, there are plenty of others that I'll link to at the end of this. And so about taking charge of your own health, I wish the screen was bigger, but here's a roadmap I'll go over about the steps you can take today and moving forward about how you can take charge. So the first one is ask. I mean, this is something you always should do. Like with any step, this is to ask about the financial conversation before treatment starts. So this would be asking your primary care provider first, this would be actually asking your oncology team first about what resources you have regarding financial navigation or social work. Every cancer center should have one. I know UAB certainly does. And use them as often as you can. They're not like oh my gosh, they're not gatekeeping. It's like, see them as often as you would a pharmacist. They're here to help. And like I said earlier, get everything you can in writing. If it's verbal, it's not binding. You need to get that recorded so you can use it to advocate for your own health. Those don't hold up when you're trying to appeal a decision. So the more information you have, the better. So it's always good. It's always good to be prepared. And along the lines of ask, you can request an itemized bill where every charge you have billing-wise is listed. Unfortunately, medical billing errors are somewhat common, but if you have the itemized bill, you can, that is the first step to seeing what you have, and that's the first step you see how to catch them and how to file an appeal to have that reversed. As for assistance, you can always ask about financial assistance, especially before a bill goes to collections. Nonprofit hospitals, they have to offer charity care / financial assistance policies. Make sure to ask about them. And you can, of course, they'll often more than not will ask for will provide you an application if asked. And as for, I guess, your finances in general, it's always important to track your total amount that you spend for your insurance to make sure, to see what your deductible is, to see what your out-of-pocket maximum is. And of course, once you hit your out-of-pocket maximum, your plan should cover 100% of covered care for the rest of the year. And I know for me personally, when you have so many documents and so many things to keep track of, if you don't have like a system, it's just going to be that much more stressful. So make sure to have building a system that works for you, something that keeps it organized. This could be a physical or digital, or honestly both, since you'll have physical documents and digital documents as well to keep everything organized. There's already so much stress that comes with being a cancer patient, so a patient with cancer. So if you keep everything organized, if you have, also just, you're never alone. Always ask for assistance. This is never something that should be done alone. You always have friends along the way, a community to help you. And last thing is, don't, I guess, self-ration. Don't like just skip a procedure because, oh, it's too expensive right now. That will more often than not come back later, but there's even more problems down the line that if you didn't get it done at first. Do everything that you can. Skipping a scan or a dose to save money usually costs more later. And you'll, like I said, ask about assistance programs first. Okay, perfect. Well, yeah, okay, that actually ends up nicely. Here are the, some national resources. Please feel free to take a picture of this. These are some national resources you can contact. There should be some websites here. You can also search them up if you need relief with copays, if you need, out-of-pocket costs help, if you need. There's also, Cancer Financial Service Coalition that, you can search up assistance programs by diagnosis. And like I mentioned earlier, there is Triage Cancer. That is the nonprofit we worked with earlier, and they have wonderful team members. They've helped several of our patients at UAB navigate different financial areas of their life affected by cancer treatment. This could be anything that was related to it, and you can see their website right there, or you can just look up Triage Cancer online. And last is, Alabama specific. I have the highlighted one in yellow, which is basically ask your personal healthcare team, whether you're at UAB or somewhere else, or like maybe your billing office at your treatment facility, about these specific programs that are offered, about the specific financial assistance, charity care. And there's also some other things as well. Legal services is definitely more of the legal side of that. They offer free civil legal aid among the Birmingham office. There's also financial assistance with the Alabama Oncology Foundation, and they, offer financial assistance for, not just Jefferson County, but other surrounding counties as well. And if you have any more questions, I'll be more than happy to help what I can. So thank you all so much, and I appreciate it. Thank you.